Good afternoon and welcome to the May monthly meeting of the Pitt County Department of Social Services Board. I'd like to call the meeting to order and observe a moment of silent prayer or silent meditation. Amen. According to the clerk to the board, there are no speakers signed up for our public comments. So then the next item would be to adopt today's agenda. First, Madam Director, do we have any amendments to?
Not that
So
I
then
have.
do we have a motion?
Motion and move that we accept the minutes.
No, we're not there yet. We're
The
adopting the
agenda.
agenda first.
Agenda, sorry, agenda.
Okay, it's been moved and properly seconded to adopt the agenda as published. Now, Becky, we have the minutes to consider.
If there are no changes or additions or subtractions.
I have no changes.
And I'll second.
So we have a motion and a second to approve the minutes as produced in the package for our April meeting. All those in favor, let it be known by saying aye.
Aye.
Okay. The first item we have is an item for consent, and it's the Lynx trip to their annual conference. Based on an action of the Board of Commissioners in the past, they want to know that we are aware of this out-of-state travel and the children that are going, and that we have approved it. So in the package, we had information on the trip, and it would be one social worker and four
students.
4 kids, young adults, young people. And it's actually in,
San Antonio.
no, but it's in August. I was like,
August,
it's
yes,
in
okay,
August.
yeah, it's in August,
So they're
end of
trying to
August.
get it now so they can make sure they've got plane tickets and all those things. Does anyone have questions about this trip?
I don't.
No.
So do we have a motion to acknowledge and approve Shantae Carson and the kids going on this trip?
I shall move.
Second.
All righty. All those in favor of approving the Lynx trip, let it be known by saying aye.
Aye.
Okay, and then the next item is an item for decision, and it's the in-home services contract. We opened the bids. We had one respondent last month, and then we sent it out for staff to review and make sure they were comfortable with. So we have Cynthia Ross and Lisa to talk about it.
So we provided a letter that was added to your packet today.
Get the microphone to work for you. Get it.
I thought it was working. Is it not working?
Now you got it.
Okay. So as indicated in here, we discussed last month the bid that was presented. There was just one single bid. It presented with an increase of $14, or increase of 50 cents, up to $14 an hour. Nikki Park, the supervisor, and I did a cost analysis essentially that will affect roughly one individual or one case over the course of the year. We would have to make that up by either doing a reduction of services as the year progresses, drop hours, decrease them slightly, or if somebody were to terminate from the program partly through the year, we just would not be able to renew that slot or add somebody. Throughout the year, when there's an adult protective services need for in-home services, we try and add them, which could compromise the services and the total number of units we can pay for in the year. We did ask for a negotiated rate. They did not agree to those terms, so we looked at the services that have been provided, the audits that have been done have been satisfactory, so we made the recommendation to accept the bid.
At the $14 an hour, which is the first rate increase they'd had in 3 years.
That's correct.
Okay. Is there a motion to award the work to interim health care for in-home services? Somehow that became a tongue twister. As per staff's recommendation and the bid that we accepted last month.
I so move.
And I'll second that.
All right. The award of the contract has been moved and seconded. All those in favor, let it be known by saying aye.
Aye.
Thanks.
Thank you.
There you go. And then, next item on the agenda is items for report, and it becomes the Jan Elliott show
Yeah.
for the next little while.
which I apologize for. The quarterly report, you have in front of you the actual report itself, and we have some slides for you to walk through that report. If you remember, this is the January through March timeframe that we're looking at. And you can see, Angela, ready to pop on? Yeah, okay. Angela's gonna work my clicker for me. As you can see, we are meeting expectations in timeliness and accuracy in food stamps. So this is the food stamps intakes and redeterminations. We are timely in doing that, and it gives you an idea of the numbers that we are serving in that quarter. And we continue to improve in this area, so that's a really good thing. If you move on to the Medicaid, okay, we're going to do the accuracy of audited food stamps. Again, we are reviewing cases for the food stamp workload as they're completed, and you can see that we are running right at 97% accuracy. We've been down and back up, but we are staying in the 94 to 97% range, which I think is very good, and our goal is 97%. Then moving on to Medicaid, you can see that our Medicaid cases are completed on time. Our intakes are meeting the 90% consistently. We have not heard for that 1 month yet that we had a slight dip. We did appeal that. We have not got an answer yet on that. But this shows you for the quarter we have been consistent in our timeliness. Okay, we move on to our redeterminations, and again, we've made significant progress there. You can see we're much more timely in that area over the last several years. If we move to the accuracy, we still have a little work to do here. The goal is 97%. We are running at 95%. But again, if you look at the report you had in front of you, we've been 94%, 94.6%, and now 95%. So again, you can see we're slowly moving forward. If you look at the paperless project, we are pretty much paperless. We cannot shred things yet until we get an approved plan, and we have continued to work with records and retention in Raleigh to make sure that our plan meets the criteria. And I think we're very close now to having that. We had to resubmit some information. So that's the holdup there, because then we can move totally to paperless. If you move to our customer service, you can see that our times have significantly reduced. And that quarter, again, January through March, was the quarter we had so many folks in for crisis services and folks in for low-income energy. And if you remember from reading the Excel report that you had, if you looked at the emergency services wait times, they averaged 88 minutes, which is pretty long, just for that group. But for everybody else coming in, the average wait time was 22 minutes. If you go to child support, we are within 0.3% of meeting the requirements for the child support timeliness and establishment of cases on time. We slowly move up every quarter, and so we believe we're moving forward there, and we'll meet it for the year. If you look at the child support cases that are requiring enforcement, we are timely in that area. We are at 82.7%, so significantly above what the threshold is there. If you move on to closures, that's something else we're measured on. We are to be at 90%, and as you see, we are closing cases in a timely manner at 99.4%. Our customer service area in child support focuses on obtaining court orders for support. And you can see that we're at 88.3% have cases under order, and the goal is to have at least 86% of our child support cases under order. And we have consistently been at that 88% level. The goal for collections for this year is that we have to collect at least $15.2 million. And we are in the third quarter, we're at 75.1%, so we are certainly on target to collect that $15.2 million. Last year, we collected 102.7% of our goal, so we would like to collect that type of percentage again this year.
So Jan, what happens with the addition?
It-
Funds?
The money goes, it's money that's going to children. So that just means we got more money for the children that we're serving. Generally, it'd be arrearages and those kinds of things. Michelle is shaking her head, yes. So the child support staff are doing a great job. If we move into childcare, we had $9.4 million that were available to be spent in childcare. We're at 69.4%. We're serving right now about 1,440 children. We are running below our average or below our expenditure levels because of NC FAST implementation and some issues that have existed with that. But
So are those issues that mean a provider's not getting paid, and so it doesn't show as spent yet because the state's behind on paying providers?
it means that there are a lot of system issues. And in fact, we have got a report that they're going to come and talk next month about what's going on in childcare. But we've got a report of there were $64,000, excuse me, I had a heart attack. $64,000 that were potentially overpaid to providers. And that, as we have worked it, have recognized that it is significantly less than that. But you can't read the reports, you can't get reports to see where you are. And with implementation, folks have been slower. So we have started ramping up. You should see at the end of this month, the end of April, when we get that report, you should see more children enrolled and a higher spending level. Because we reached out and added about 80 children from the waiting list. And so they would have gone in April. But without knowing what you've spent, it's just been very difficult to gauge this year. We do have, yeah.
Concern is that they're behind on paying, so you think you've got extra funds, you add new kids, and then they get that backlog processed, and suddenly those extra funds were really just not extra.
Well, yeah, and they've taken funds from wrong pots of money. For some of the counties, they took Smart Start dollars, and those counties didn't have Smart Start allocations. So it's just been difficult this year. We do have some underpayments in answer to your question, but we believe it's a very small number, and we're working with those families. The state wouldn't even let us begin to address overpayments and underpayments until the end of April. So they've been trying to figure out what they have in the way of overpayments and underpayments. So we are working hard on getting that done. But again, staff will report next month as to where we stand with child care and what's going on with child care, because I thought it was important for you to hear what is happening there. We are spending about 92% of our allocation, between 92 and 93%. We would want to be much closer to 100%. So we'll see where that goes. For our adult services, you can see that we're seeing continued growth in our adult protective services reports. We've had 330 reports thus far this year. And again, you see with our individuals served by the adults, adults consenting to say, yes, I would like this service. In this last quarter, we had 17 folks. The month before it was, the quarter before it was 30. And we are having to.
Individuals per quarter, that's not a cumulative thing.
No, it's per quarter. It's the new ones for that quarter. So then when you get to serve with APS by court order, we do have to sometimes go to court because they will not consent to services. And so we had to get 18 court orders during that particular quarter to provide services. And if you've got any questions about APS, Cynthia's sitting back there who can help you. So now looking at the guardianship caseload, again, we are now at, and this is cumulative, we are now at 134 guardianship cases. And I keep reminding that when I got here 4 years ago, we had 80. So, we established 15 new orders. We are giving orders, or orders are being given to other individuals in families who are willing to take on that guardianship, but frequently we are the only people who can serve. So you see that we had 33% this past quarter that had others besides us named as guardian. Okay, so if you move now to the fact that we're trying to keep folks in a safe and stable, least restrictive environment, these are our in-home services, such as the money we just talked about a minute ago. We are continuing to increase the number of slots used with our CAP program, and we have had a vacancy there. So I'm really pleased to see that we've done as well as we have. We have 73 folks who are able to use in-home aid respite services, and we've in-home aid and respite services, and we have used 75% of our SA in-home slots. Again, we are increasing the numbers of folks who are served, and so that's a good thing. And that means we're able to keep more folks in their homes as opposed to having to go into a facility. Protective services, you're going to see that we are doing, we've been up and down, but right now we are at 94.8% of our children are not repeat victims, and the goal is 95%. So we continue to push hard in that area. As far as child placement is concerned, we had 87% achieved permanence within 12 months of coming into placement. And the goal is 75%. Okay. Of our foster care youth, our goal is to have only 1 or 2 placements within 12 months. That is a real struggle for some of our children. We are at 85.5% right now. And again, it's important for children to have stability.
Are those all different types of placements, Jan?
All different types of placements. So then if we move into the 12 to 24 month period, we are at 60% right now, and the goal is 65%. Again, you're shooting for 1 to 2 temporary placements. So if you move on to the percentage of youth in foster care for more than 24 months, with just a few placements, 1 to 2 placements, we are actually slightly exceeding the goal of 42%. And so those kids have stabilized in that situation. Now, if you look at NC Fast, oh my. We have not gone into NC Fast yet. We continue to work towards that. We continue to be pushed back in going into NC Fast. The current date is August that we will go into NC Fast in child welfare. The state is continuing to try and fine-tune. They did bring some additional counties on in pilot status to work with the system. And so hopefully by the time we get into the system, most of those bugs will be out. So the vacant positions. We are slowly reducing the average number of days and the maximum number of days to fill vacancies. That is something that I think staff, the supervisors are working hard. We recruited 18 staff in the last quarter. We still have a couple of positions that have been very hard to fill, and it's taking us a significant amount of time to fill those positions. They're primarily, we've got 1 in adult services and some in child welfare that have been very difficult to fill.
Jan, what is making it so difficult to fill?
Salary is one of the issues. The demand.
Demand meaning?
Demand for social workers, because there's a significant demand for social workers to be, and trained social workers specifically. We're not getting a lot of applicants for some of these positions that meet the qualifications that we really need to have. And if you look at the type of job that our folks are doing, they're on 24/7. They don't necessarily get to go home at 5 o'clock lots of days. And if you could work in other places, your day could be much more stabilized and you might not have to work weekends. And so I think the knowledge of the work we do probably keeps some folks from wanting to apply.
Is
But
this-
there's a lot of demand out there.
Is this true with all county departments, or is
Yes.
it
County departments are really struggling.
for?
Social workers, primarily, again, in child welfare, but we are seeing some of those issues in adult services. And statewide, there's been a lot of push to try and figure out ways to do better recruitment, to entice folks to come. We're working with the universities. I mean, the counties are doing a lot. The NASW is working also to help us recruit, but they certainly are pushing that to be called a social worker, you need to have a BSW or an MSW. And you know, we have a fair number of staff who are MSWs or BSWs, but it's probably not even 50% of the staff that are doing social work here. So it's a struggle, yeah, and then you've got to get folks into all the pre-service training unless they've managed to get it through other sources, which can take months to get that done, and of course, they can't work without the pre-service training.
This may or may not be the time to ask Dr. Bunch a question, and if it's not the time, y'all tell me. But are you seeing differences in your students as to the route that they are taking after graduating, say from a MSW program? Or rather than going to departments of social services, are you seeing them taking other avenues
Other job
for employment?
Currently, we're seeing them take other avenues.
Such
going
as in?
Mental health, home health and hospice is a very popular field to go into, and they're getting jobs in those areas. We only had 5 undergraduates to graduate with the pre-service competencies.
Which is what Jan just referenced.
And only 2 MSWs to graduate with the pre-service competencies last week.
Is salary the shortfall? I mean, is salary the deterrent? And I'm talking about all over, everywhere.
I think salary is a deterrent because salary varies based on the county in which you live. Salary stories about the amount of work that is
With the
being
DSS.
required. And so, and then it's a wide open market. Everybody is looking for social workers.
Okay.
We get calls all the time. And I think one of the issues that the DSS directors will have to look at would be issues of retention. How do you work with your organizational culture to retain the workers that you have?
And retention is a real struggle for us right now. And again, when you're carrying, you know, more than your caseload, and every crisis that comes up, you're expected to solve it, and you're there until it's solved. Placement of children in facilities, finding beds for the children when they're provided to you at 4 in the afternoon, and you've got to find a bed, and they're wearing an ankle monitor. You know, so our children bring challenges for us, and then that then brings challenges for the social workers.
Huge demands.
Right, and you know, although we do have 4 positions that work after hours to do CPS that when it comes in after hours. Right now, those have been vacant, and we've just now gotten back up almost to full staff there. So staff have had to rotate on call in addition to do their day work, and so all of those things I think have caused folks to not stay, not be happy, and so they're leaving, and they're not going to other DSSs. They're going to health departments, and they're going to, you know, mental health. They're going to the GAL. They're going places where the workload is such that they can say, it's 5 o'clock, it's time to go home.
Thank y'all very much.
Sheila, back in the day, you know, the early days of the Child Welfare Collaborative, social work students, there were some incentives for them to go into child welfare. They used
Yes.
TANF funds, and I think there was a tuition component to that
A
too.
tuition component, a stipend,
Yeah,
all
Yeah.
those incentives have
have
disappeared.
they? Because I think they used TANF money to do that back in the day.
Right.
The only incentive now would be your marketable ability to go into the job, and there are bidding wars between DSS agencies. If somebody knows that you have pre-service already, they're going to fight for you.
Well, why do some of your students have pre-service and some don't?
It's a choice. It's a choice to make a decision to go into child welfare practice, and then they are able to get some of those competencies in the classroom, and then they're able to take some online through UNC Chapel Hill, because they have the primary contract right now with the Division of Social Services to actually monitor and run that program through several universities.
And it gives you some extra status in the agency if you can come in with pre-service. You know, and one of the things, and our chairman helped spark that, is that, you know, folks who do come to government service can eventually maybe get help with their student loans as a result of working through coming into DSS. So some of that student loan
As an incentive.
might be forgiven, so we need to be advertising that
Yes,
probably more
indeed.
than we do. We also have gotten permission to do some negotiation on salary. Up until recently, this social services department did no negotiation. You came in on step one, and that was all you could come in with. And so if you remember, we brought forward a plan to try and pay a little bit more if you had certain skills, like pre-service. You've had experience on the job. You have a master's degree in social work. Those kinds of things will get you an extra step, so that we can negotiate up to step 5 if people have that need and bring those skills.
And what about experience? Does that also bring in?
Experience, degree, being bilingual. Those are some of the things that we're looking at.
Okay. Sorry to get off track, but I felt that
Okay.
was important.
Right, so if we look at our budgeted expenses and revenues, just as a reminder, the budget was reduced at mid-year because we took the child care dollars out since it's no longer running through our department. And so you can see that our revenues right now are running about 11% below where they should be at this point. We have just now gotten our employment and training program to where they are ready to allow us to get paid. So we will be getting those revenues in a lump sum. So that's going to bump up the revenue significantly. Also, there'll be some settlements that haven't been done. So we will be using all of our available state and federal dollars and our MOE. So we should meet our goals for revenue when compared with expenses. And as you see, our expenses are running below also. We're about 7% below on expenses. And that, we should stay pretty consistent there. I'm not anticipating any extensive expenses between now and the end of the year. We should end the year about 7% below. So that is where we are as far as our quarterly data. So anybody got any questions beyond what we've already talked about? Okay. So, and I'm not ready to talk about that yet, Susan, but good, it's up. Okay, so let's talk about, the next thing that was on our agenda was the draft DHHS agreement that we are going to be expected to sign, and the "we" is probably the county manager is going to be expected to sign it, not the DSS director. Based on one of the conversations, it was going to be the chairman of the county commissioners, but now it's appearing to be the county manager. We do have the opportunity to provide input, additional input. This is like the third draft. and that has to be done by May the 11th. So if anybody looks at anything and sees something that really concerns them, let me know. The agreement will go into effect July 1, and it is an agreement between the Department of Health and Human Services and, in our case, Pitt County, the subdivision. We are going to have to, as part of this agreement, disclose the names of all of our subcontractors. And for us, that's a significant number. I think we believe we have about 130 contracts that we will be needing to provide information on. That would be folks like Community Crossroads, Interim, like we just talked about, Life NC, and lots of other organizations. So we're still trying to make sure exactly who they believe. Do they want all our transportation providers, for example, to be provided to them? Do they want all of the folks that we contract with for energy, all those different energy providers, who are just delivering the gallons of oil or the electricity or whatever. So we're still trying to clarify some of that, but right now we have about 130. If you look at the next page, it shows that this particular agreement will run through June 30 of 2019. And in the event the county fails to satisfy the mandated performance requirements or fails to otherwise comply with the terms of the agreement, the state can withhold state and/or federal funding. But prior to doing that, obviously, there would be corrective action, and that was set out in the attachment. There are a long list of attachments here, and these are primarily the performance criteria we're going to be expected to meet. And we'll look at some of those in just a minute. There is an audit requirement, obviously, and we are to provide books, records, information, anything that the state auditor or the department feels that they need to see. I'm not going to go through all of this because there's a lot of it's pretty self-explanatory. In here, they indicate on page 4 that the parties acknowledge and agree that this agreement is not intended to supersede or limit any obligations, from the federal, state, rules, laws, policy, standards, etc. And then we have to determine, and that will be something the county manager and I will talk about, who is going to be named to be the person for whom notices are to go to for this agreement, because they will be doing a variety of notices at various points in town, and then one of us will also be signing.
Is there an option for dual notice?
They do not reference that here, but I will be able to ask that question this week.
And I just
So,
asked based on my history with the centralized agreement with mental health, and notices were going to the mental health director, and the county was blissfully ignorant
Right.
about how bad things were
Right.
until suddenly we were able to get notices to come to the
Right.
county as well. And so I think in a spirit of cooperation, notice needs to go to both agencies.
Based
Or
on
both
what,
entities, the DSS department and the county.
based on what I would assume, and you know where that gets me, but based on what I would assume is they will CC the other party, as
That's-
opposed to being the official notification. There would be a notification to one and a CC to the other.
That would be nice to
Right.
ensure.
Which is why the discussion has been with the County Commissioners Association that the county needs to be the signer of the agreement, not the DSS director. The department is going to establish standardized metrics for us. The department is going to provide supervision, program monitoring, technical assistance. One of the things that we ask to have in there is that we get timely written guidance, and that we get timely policy, and so all those kinds of things are spelled out in there. Timely is not defined, however. Well, they do say as soon as we can do it. Financial resources are discussed in here, but basically it's that the financial resources are utilized by the county in compliance with law and policy, which you would expect. And that we are going to be submitting data to them, and I'm assuming it is the data that they want in the addendums, Some of that data they'll be able to get off of the systems information that's out there, and some of it they're not currently collecting, and so I suspect they're going to be asking us to provide that data until they can get the system to do that for them. So that data could be everything from timeliness of process and applications, quality control, program statistics, and fiscal information. They're going to say that all policies covering social services will be in a central, accessible location. Today, they're everywhere. They're in letters, they're in addendums, they're in computer-generated stuff, they're in a manual that's online, they're everywhere. So that is something they've agreed to do. They have also indicated that they will communicate directly with the county manager, governing boards, and county director of social services on matters including, but not limited to, corrective action, performance improvement plans, and significant changes to law, rule, and policy that impact the administration of social services programs covered by this agreement, which is why I believe they're going to do the CCs and all that kind of
And
thing.
making reference to they, is they a collective body?
They is DHHS.
So, okay.
The agreement also gets into the emergency operations plan, sheltering, all those kinds of things are spoken to in this agreement. So that's sort of the responsibilities of the department. And as I said, timely is defined as within a reasonable time under the circumstances. So when you get to the county, we are to ensure that the county's provision of social services is done by qualified staff who possess the knowledge, skills, and abilities. We're to ensure that we complete all required and necessary training and that it's documented. Nothing in there that's really out of line. Compliance, internal controls, corrective action, data submission, how communication is going to occur. One of the things that that's spelled out in here is that we are to provide timely information regarding temporary or permanent changes to the Social Services Board or the Social Services Director, including retirements, separations, or leave of absences that are greater than 2 weeks. So, I hadn't thought about the leave of absences, but I would have felt like the other things would have been happening anyway. Interagency cooperation, here's where they're getting into the disaster information and what we're supposed to do. And on page 8, there's the data reporting. And then the county, by signing this agreement, agrees and submits solely for matters concerning this agreement to the exclusive jurisdiction of the courts of Wake County, North Carolina in Wake County. So that'll be the venue. So then we get into, after you get past the signature page, we get into what the performance requirements are. And so this year, they're going to be pretty much the same for every county, with the exception of child support, because child support already has individual performance indicators outlined for every county. But the rest of us, it'll all look the same. So if you look at the performance indicators and that are going to be we're going to be held accountable for, I'm going to compare those to some of the things we're already giving you reports for, and then we need to decide as a group, what do you want as a board, and we don't have to decide it today, but what do you want as a board for us to report on? This information or what we're currently reporting on, or some combination thereof. But if you go to the first page, we are to initiate 95% of all screened-in reports within required timeframes for child welfare. It is not currently being reported that way to you in our indicators report.
Here, and before you get into a lot, here would be mine, because this is what you are going to be judged on. My personal idea would be report on status towards meeting the state agreement. And that just become the new benchmarks for everything you do, because that's how you're graded, that's how your monies come in. So,
And failure to meet these could result in takeover.
exactly.
So,
I would think you would just want to say, here's what the state says we've got to do, and here's how we're doing towards meeting that goal. And
Seems
that
reasonable.
just becomes the roadmap.
okay.
Then you're not having to keep two sets of
Separate.
Right.
data.
Right, and it feels to me like that would be too many things to be tracking, so that's why I wanted y'all to have that conversation. Just to run through this real quickly, ensure 85% of our in-home cases have been open less than 180 calendar days without seeking court intervention. Obviously, we're not reporting that to you now. No more than 9% of our children or enclosed in-home cases will experience repeat maltreatment within 12 months. We sort of do that now for you.
But are any of these things impossible to track the way the state wants you to track them?
The state is tracking some of these things now, but they're tracking them after the fact, right, Tammy? You'll have to help me with that. Because you've gotta get through you've gotta have a few months down the road before you can say, did children not have a repeat maltreatment within 12 months? So, you know, I don't know how much of these they're gonna want us to track individually so they can have quick data, and how much they're gonna use through the data they're collecting. Most everything that they are talking about here is on the federal data management that we're supposed to meet too. So, some of this I think they're gonna be able to provide, but will it be timely? Which has been my question, because they're also going to develop a dashboard for us that is going to be front-facing, that the public can look at any point in time. And I'm not sure that the dashboard is gonna look exactly like this. Because the dashboard, is probably gonna need to be more timely kind of information. But we don't know yet, they're still developing, so it could be this, it could be something different. They're gonna have to put some computer supports in here to capture the information, they're not capturing it now. Now, we're an advantage probably that some departments are in that we have a data analyst in our child welfare section. We have a data analyst, in the rest of the agency, who serves everybody but child welfare. So we can probably, you know, start thinking about some ways internally if we find that the state's not. Because they want us to submit data to them, so I'm thinking we're gonna have to capture some of this.
Jan, how active is your association involved with this? Since everybody's gonna have to be doing it, I would hope they're getting a lot of support from your association.
The association, that's why we've had 3 reviews of this document already, 3 iterations of the document. We are meeting with them again this week to talk about this. The document has changed dramatically since the first version came out. The mandated performance requirements, we have had some discussion about. We've seen some change as a result of that discussion. There's still a few areas we've never been measured in this manner on these particular performance requirements, or if we have been, it's been in a much lower level. So when we get to adult protective services, for example, we have been measured at 70%, we're suddenly going to 95%, as going to be the approved place to go. And so, and that is probably what is in law and policy, but we've never been measured at that, and we've been reviewed once every 3 years, and now it's going to be a monthly target we've got to meet, so.
And that was gonna be the other part of my question a while ago, is anything that we were setting a mark, have they set a mark that's so substantially higher in that same area that we have grave concerns that we
Well,
can meet it?
Yeah, we're gonna struggle in some of these areas to meet, and especially if we continue to have turnover, or we are significantly understaffed. So, you know, we can go through these. The child welfare foster care stuff is information that is part of the federal review process. We are currently tracking some of the things here, like 95% of the foster youth will be established. Let's see, permanency goals for 95% of foster youth will be established within 60 days of a child entering custody. We're not tracking that for our purposes today, but it is being tracked for the state and federal. The 95% are gonna have face-to-face visits, 41% are gonna be discharged within 12 months of coming into care. And right now, by the way, we're currently, if I read this right, we're currently at 87%. So we're doing well to have the discharge permanency, at least in the last quarter. Now, where we are today is a different story, I suspect. Annual rate of repeat maltreatment's gotta be below 8.5%. Enter foster care in a 12-month period, discharge within 12 months, no more than 8.3% can re-enter foster care. So, I mean, we can look at all these. The one that's interesting is county will ensure that all children who enter foster care in a 12-month period, the rate of placement moves per 1,000 days will not exceed 4.1%. And so that's gonna be, something we've not necessarily been tracking, although I think, the state is tracking that for us. In child support, all of the child support measurements are the federal measurements. They are specific to our county. Some of them are statewide performance indicators. Generally, we are doing well in all of these areas and not particularly concerned as long as we can continue with our staffing that we've got and not have a lot of vacancies and things. I think we can pretty much meet these. We fell behind during the snow because court days got canceled, and so that had some impact. We had extra court days, so hopefully we're catching those back up. But you can look at all the performance measures there. If you look at the energy program, I will tell you that we have to process 95% of our crisis intervention applications within 1 business day if they have no heat or cooling source, and 2 business days if they still have their heat or cooling source. And that is policy, and I think we pretty well try to do that. I'm not sure when you have 150 people at your door and 5 people trying to do it, that we have always made that goal. Oops, I'm sorry. For our Work First, we really haven't paid a whole lot of attention to Work First application processing because it's such a small number. So we're not collecting any of the data they're asking for in Work First officially internally. I have no problem with believing that we are meeting all of these requirements just because it's such a low number. Now, what I will tell you is going to be the trick is number 2, the county will collect documentation from 90% of 2-parent families with work-eligible individuals, verifying they've completed the required number of hours. The state is not meeting that, and that is a federal requirement. So that one, and there's such few 2-parent families that it's going to be a difficult one to meet. I think we never have more but 1 or 2 2-parent families at any given time, so it's a really small number. So as far as food stamps, we're reporting all the things and meeting all the things that are listed here, with the exception of the 100% program integrity claims are established within 180 days of date of discovery. We are meeting that right now. But if staffing, there are times when staffing is such and you get Medicaid claims and you get Work First claims or you get daycare claims, that can throw the food stamp claims out of whack and you get behind and aren't meeting 100%. So, but right now, 100% at 180 days is happening. And they are tracking that now and are paying close attention to it now. For APS, the county will initiate 95% of APS reports alleging abuse or danger of death immediately, 95% alleging neglect or exploitation or maltreatment with other than abuse or death, danger of death within 72 hours, completing the 95% of evaluations within 30 days, and 85% of evaluations alleging exploitation within 45 days. Cynthia says these are going to be tough to meet. 1, we have staffing issues, and 2, for some of these exploitation cases can go a long time trying to work through the financials and those kinds of things. So it will be difficult to meet these.
So, Jen, as you are reporting these things and looking at the things you meet and do not meet, is there a response that you can give that reports like organizational factors, environmental factors, as a response?
days.
Snow
Take it
days.
To mitigate,
Yeah,
mitigate.
mitigating factors.
well, when when we get to the end of this, there is if you miss 3 consecutive months on any performance indicator, or 5 months out of 12, then there's going to be a reach out to say you are having a problem. There will be an opportunity to try to say, here is why we did not meet that.
Okay.
Snow days might get us somewhere. Not having staff probably will not get us anywhere, because they're gonna want a corrective action plan on how we're going to solve the problem and not have it again. And if we continue to not meet, then the next step would be withholding money. And withholding money just makes the problem worse, but that would be the next step. And then the next step would be the potential takeover. They can, in child welfare, if the secretary feels like it is a serious enough problem, she can come in today and take over, and has done it recently in a county without even going through all the hoops.
And that's the county in the west.
In the west, yes.
Okay.
So, they have the same power already in Medicaid, have not done that much in the Medicaid program for application processing issues, but have taken over several counties in child welfare, but most recently the one in the west. So, yes, there are some mitigating factors, but we may or may not get a whole
Jan,
lot
when
from
they
this.
take over, what's that look like? What do they do?
They bring in staff
They bring in staff.
who are going to take a look at what are the problems, what's caused the issues, why are we not, making the progress we need to make. If it is financial, then they will, send out for staff, and the county will pay the bill. If it is leadership, then they will deal with that issue too. During the most recent takeover, the director has not been allowed to have anything to do with child welfare. She's continued to run the rest of the agency, but nothing to do with child welfare. The board has now suspended the director for 30 days, so they brought in a temporary person. But initially, when they went in, they took over the total operation of the child welfare program. That means they did the training that needed to be done. They looked at how things were flowing. They looked to make sure they understood policy and procedure. They looked at staffing needs, et cetera.
With issues like staffing, where it sounds like it's across the board for DSSs in terms of retention staffing, is there thinking about developing strategies to support DSSs in terms of recruitment, retention, across the board, so kind of a preventative piece?
There's been a lot of discussion and attempts as far as social workers to look at ways that we can, one, increase the numbers of social workers, increase the interest in working for DSSs. What can we do to help improve the culture of the agency? Those kinds of things are being looked at, and the Directors Association is involved in some pieces of that. The schools of social work are significantly involved in some of that. It's going to be a long process. Yeah. It's not immediate by any means. So, and when we get to child care subsidy, we're at 98%, they're requiring 95%. But if you look at the corrective action, it walks you through on page 20 and 21 the specific requirements about how we're going to move corrective action forward. So, anyway, that is the agreement. If you all, after you look at it, have any comments you wish to make, I will take them to Raleigh with me, email me, because we will be talking. But we will be under this agreement come July 1. So, Tammy, Cynthia, Michelle, Brian, anybody have any comments related to any of this agreement?
I do. It's probably the first time I've really noticed that we have mandates, and the answers we get from the state about why are these mandates for, I'm sorry, I forget.
You know the television.
As we look at these mandates, the answer that the state gives us is, why are we having these in here? Why is there a jump from 70% expectation to 95? Dr. Bunch, you asked, is there any extenuating circumstances? When we've been monitored by the state, we couldn't complete this evaluation because medical information not returned from the doctor, but the social worker asked for it timely. You can put all that information, and when you get audited, you will get credit and say, yes, that case was managed appropriately. Okay. This is cut and dry numbers. It will be measured by, this case was done on this date, case decision was done on this date, and that's how they'll get the data. So there won't be that opportunity for that. And when you compare just the adult protective services piece and the evaluation, they're expected that 95% of case decisions will be made within the 30-day time frame. That time frame is not set in child welfare, just in adult services. So they've raised the bar, but what counties are going to be held accountable for in APS, it's not been that way.
Thank you.
Okay, so, let's see how fast I can get through the director's report. The vacancies, we have promoted from within. We have some new folks coming on board. We continue to run, we've been hanging just below 20 positions for a while, so we're at 19 right now. We have 5 that are currently frozen. So we are continuing to work our vacancies on a regular basis to see what we can do. If you look at our application processing report, we are back where we need to be. We are at 93% processed timely for MADs and 95% for other Medicaids. And you can see the days it's taken us to process these cases, so staff are doing an outstanding job. Okay. Some of you were interested in hearing about what's going on with the social services and child welfare reform plans and House Bill 630, and this is part of House Bill 630. I'm sorry Commissioner Perkins-Williams in here because she has a great interest in this and is who had specifically asked for this to be part of the agenda. As you look at the plans, and I'm just going to hit the highlights, this is the company, the Center for Support of Families is the company that is doing the child welfare reform plan. They were the winner of the contract that was put out as a part of House Bill 630. And so you should have handouts on this so that you can look at those. And this, although this is supposed to be a social services reform plan, if you remember, House Bill 630 started as a child welfare bill, and so there's a whole lot of interest in the child welfare side of things. If you look at the social services reform side of things, they're going to be looking in phase 1 at state supervision, accountability for the social services system to include child welfare, adult protective services, child support, and public assistance. So they're going to be looking at all those things, but particularly have an interest in the child welfare area. So when they look at the child welfare research questions that they're asking, are children and their household members that are coming to DSS through a report of possible maltreatment receiving the right response? Are they those in open CPS cases, are they receiving a response that ensures children are safe? How does the North Carolina Child Fatality Review Protocol work? And how does that compare to what other states do? And are reasonable efforts being done to prevent custody prior to children coming into care? When you look at the system itself, they're going to be looking at developing the transparency wellness dashboard, assessing current social services metrics, identifying critical performance metrics, not just for frontline staff, but for state and local managers and stakeholders, which is a pretty broad discussion there. They're going to be recommending specific prototype dashboards, and they're going to be creating, testing, and deploying the dashboards. And again, I'm trying to figure out where the dashboards and the performance requirements meet. A lot of the performance requirements are in state and federal law. So they're also completing a review of available information at the state level, statutes, policies. CFSR is the federal review process. Administrative data that's available to the public now. What supplemental data do we need to gather? And they're going to use focus groups, interviews, administrative data reports that they're specifically getting, and there's going to be a survey done during May and June. And the best practice review is done because April 30 has now come. I borrowed these from a presentation that was done from at another meeting. So they have met that deadline and are getting ready to start sharing that information. They are also completing a review of available information. They're going to be looking again at additional supplemental data. They're going to be talking about best practices, organizational structure. They met with the 16 big counties, and Tammy was part of that, Tammy and Brian, and talked about this process and what they were going to be doing and began to have some conversation. They're going to go, they went to the director retreat that was held in April that I didn't get to go to. They're going to do some county visits. They're meeting this week with all the association committees to try and get information for this. And they'll be going to the regional meetings. So they're trying to hit as much as they can hit because they've got a very short turnaround. So they're asking us to certainly complete the surveys that are coming, send those organizational charts, all that information. They want us to be sure to participate in the focus groups and give them feedback on dashboard prototypes. The focus groups and interviews are going to be conducted in May and June. The draft report is due July 27th. Now remember, they didn't even hire this group till March, so they are moving really fast. The final report, along with the first version of the dashboards, due the end of August. They will be going to the Oversight Committee at the Legislature in September, and then the implementation strategies will be developed as a second phase. So that's what's going on with that part of the House Bill 630 work. The other part of the House Bill 630 work is what's going on with the Social Services Working Group. And so their charge now, they met May the 2nd for the first time, and their charge is to develop recommendations regarding legislative and regulatory changes to improve collaboration between counties. They are to develop a vision for transitioning the state from a county administered system to a regionally administered system. And you should have this information in your packet. And then they will move to stage 2, which is going to be a report that's going to be given to the legislature by February 1. So in May through August, they're going to be gathering information. They're going to be doing surveys of social services directors. They're going to facilitate discussions at legal conference. They're going to be facilitating work with social services attorneys. They're going to have a focus group with county commissioners around regional administration. They are going to meet with social services board members in one group to discuss regional administration. They are going to have open and mixed focus groups. They're going to work with those other stakeholders, like the GALs, the guardian ad litems, the Office of Defense, Indigent Defense Services, Partnership for Children, a lot of those different groups. They are going to also talk with the Social Services Commission folks, and they're going to post a public survey online at their website, which is at the microsite for the general public to respond to. Then the School of Government is going to gather all this information, and then September through October, they're going to share that information with the work group to begin developing recommendations about first improving inter-county collaboration and prepare draft legislation to accompany that recommendation. October through November, they're going to discuss transitioning from a county-administered social services system to a regionally administered system, and they will work to develop a vision for making that transition. There is no charge about presenting legislation for that particular section. And again, the final report has to be February 1 to the legislature. So that's kind of where we are with the work group at this point, and House Bill 630. So a lot is going on. They did do their presentation to the Joint Legislative Oversight Committee about regional offices for supervision. That's already been done. So, since we've already got the Medicaid transformation update up here, we'll go ahead and do that now. And again, I have borrowed from some people who did a presentation. These are the folks in charge of the Medicaid managed care transition. And, you know, I'm giving you just a brief reminder of the goals that are out there for this transformation. And obviously, they want predictable cost, which is not stated here as a goal, but it is one of the goals. So here's kind of where they are. The legislature has to approve some of the changes that were made to the waiver back in November, and they will be doing that at the short session. And then we can move forward. The RFP for the prepaid health plans is going out shortly, and they're due back September, October timeframe for decisions on who is going to be the prepaid health plan administrators. So there's a lot of jockeying going on right now from lots of different groups and about who's going to win these. Remember, there will be 3 statewide and 12 across the 6 regions. Now, those 12 won't be in every region. They may be 2 in one region and 2 in another region, but there will be 12 total regional providers identified, prepaid health plan providers, plus the 3 statewide. So Pitt County could have as many as 5 prepaid health plan providers in the county for folks to choose from. And so there's going to be financial risk for all these folks because remember, they're doing per member per month payments. And you see that there's going to be an upcoming concept paper about how it's going to impact DSS operations. That has not come out yet. The implementation rollout would begin January of 2019, and the actual enrollment would begin January 2019. Actual rollout would start July 1, 2019, assuming the waiver's approved, and would run through June 30 of 2020 to give folks a time to get into these plans. They'll do it by region. So one region might roll out first, they'll get all those folks done, and they'll move to other regions. Those would be the standard plans, and about 73% of the Medicaid eligibles today would roll out in year 1. And standard plan would include some mental health coverage for some of those less complex mental health issues. Now, who's not covered by this plan are dual eligibles. They're Medicaid, Medicare. Those folks that are considered emergency services only, presumptive eligibility, which would be the pregnant women, those that are, we're just paying health insurance premiums, family planning is all we pay for, and prison inmates would not be covered in any of this. So it's going to look really different. The behavioral health, intellectual, and developmentally delayed tailored plans would start in year 3. So the next thing, the managed care plan overview, and it's changing how Medicaid benefits are delivered, fee for service to the managed care. And so they're going to be looking at, when they're making the decisions about network adequacy, care management services, and the quality strategy that these folks are going to have. So that's how they're going to make their decisions. And here there's a slide about what network adequacy means. And I think the key things here are they want to make sure that the folks who need them don't have to travel too far, have access to the care, and they're considering how people with disabilities or special needs might be served. And so there's going to be an access plan that's going to be really important. They're also going to be looking, you can get out-of-network services if your plan does not have in-network services and if it's not any more increased cost. They want folks to have access to essential safety net providers. Telemedicine is something they're going to be looking at. But again, it is not to be a substitute for face-to-face. And then they want to have increased inpatient and residential substance use disorder behavioral health treatments. And the IMDs are institutions for mental disease. So then you move to care management, and this is going to be a huge piece, is care management. And that's sort of what Access East and some of those kinds of organizations that were put together by CCNC over the years do today. So they're going to be looking at the issues you see here, but the key principle is that all Medicaid enrollees will have access to appropriate care management, coordination, support across multiple settings of care, and a strong basis in primary care and connection to specialty care and community-based resources. And they've got to meet outcomes. And by the way, SDOH is social determinants of health. So that'd be things like food, housing, those kinds of things are going to be part of the care management process. They're going to be key performance indicators folks are going to have to meet. And they're going to be looking at emergency department utilization, inpatient utilization, and readmission rates. And so here are some of the things that they're going to be working with them on, things like controlling high blood pressure, follow-up, cervical cancer screening, those kinds of things. There are going to be folks from DSS involved in some work groups as they begin to work on the DSS piece of this to figure out what are the impacts on social services, what are the potential automation risks, and these are pretty significant, and we'll explain that in a minute. Look at, staff training needs, and then from this they're going to put together the managed care DSS concept paper. So local staff from different DSSs are being asked to participate in this. The areas that DSS is going to be most impacted in, we believe, are eligibility and enrollment, non-emergency medical transportation. Rather than us contracting for that 73% who are receiving managed care, the primary health provider is going to contract for that transportation for those individuals. So this could have a fairly significant impact on our transportation providers because they are going to be negotiating for a cost to fit within their fee structure. So we don't truly know what that's going to look like. For NC Fast, there are going to be a lot of changes as they move towards an integrated web-enabled platform. So their goal is ultimately to have the client fill out the application online and be told they're eligible through that online application process without bringing us into the mix for many of the clients. And we don't know how that will go or when that will happen. Since NC Fast still locks up every 15 minutes. No. Since NC Fast still has a lot of problems, it's going to take some work to get that ready to go. The financial considerations, what are the costs, staff shifts, impacts on PATS, for example, could be significant. Right now, there's no change in eligibility or post-eligibility regarding income. We still are determining eligibility as we do today. Again, you see over time a streamlined, integrated eligibility enrollment, no-touch process to be implemented. In the interim, you still do it as you do today. The provider choice can be noted on the application, or they can be auto-assigned if they don't choose somebody based on who they're currently using as a provider. And if that provider is in that network, then you might be assigned to that network if you don't choose somebody. There'll be a 60-day open enrollment and then a 90-day choice period. Special populations will get phased in. You can unenroll without calls, with calls, there's different reasons. And there will be a provider directory that the clients can use to figure it out. So the flow, as they envision it right now, is DSS or NC Fast, depending on where we are, will determine eligibility and transmit that information to NC Tracks. then either DHHS or NC Fast will assign the member to the health plan, and then transmit that assignment to the enrollment broker. And the enrollment broker is going to get the plan set up or change it if needed, and then the plan itself will manage the enrollment and health insurance, handle the primary care provider selection, and the management. So that's what it's going to look like. The enrollment broker is an individual that performs counseling and enrollment activities, or both. So helping them think about the SHIP folks. And I'm trying to envision it like with the Medicare enrollment, trying to help you think through, you know, what's best for you. This is the kind of thing that these folks will be doing, and you can see there what some of those things are. Still trying to figure out whether it will be done, whether there will be enrollment brokers in the different DSS offices, or if they'll be electronic, you know, sit on the phone. We suspect, based on conversations, that larger agencies probably will have some in-person enrollment brokers. Some of the smaller counties may well be done over the phone. And here's the discussion about non-emergency management, non-emergency medical transportation. So you see how we work today. We pretty much set it all up. The vendor then bills NC Tracks, and we just go like that. So everything except bus vouchers and gas vouchers will go through this new setup. We might, you know, pay for somebody to have a bus pass, or we might pay mileage for somebody who's going in their own car. We would continue to do that, but the rest of it would go through this new process. So tomorrow, this is how it will look. It's a managed care service. It's for all mandatory populations. It's going to impact those private providers of transportation. So they're going to contract directly with the vendor or use a broker. They will follow the policies we currently follow. They will establish rates for reimbursement. They're going to deal with the same behavioral issues that we deal with, you know, like folks who miss appointments and those kinds of things and don't call. They will provide training to the providers, and they will be working with providers around quality of care, et cetera. So this is what it's going to look like in the future. It will continue to be a fee-for-service for those populations that have delayed participation, so we'll continue with the fee-for-service there. And so that'll be a very small population. Then here's your training plan, and I won't spend much time on that, but this is the training plan that DSS staff are going to have to get education on. And then you see here what the topics are, both for DHHS, for the enrollment broker, and what eligibility workers, et cetera, will need to know. And then the transportation providers are going to need to know what populations are affected, how it's going to look for them. And they're already beginning to have some conversations because PATS has already reached out to us about some questions. So that's pretty much what's going on with Medicaid transformation. It's a lot. It's going to be a major shift for the folks that we are serving. So just FYI on that. Anybody got a question about that? And then I'll move really fast for the rest of this. Okay, we had the legislative breakfast. We worked with the county commissioners to do that. We had a handout, which you have a copy of, that we gave the legislators. Had some good discussion, I think. Do not believe that we need to do a separate meeting of any sort, because I think we pretty well covered it. Got some of our points across, I think. Still don't have anybody who's had a name submitted for the board appointment. So, you know, if y'all have ideas, go out and talk to folks. As far as the budget update is concerned, the manager met with the commissioners yesterday and has come up with a plan that, and Brian can help me on this if he needs to, come up with a plan that would allow us to get our foster care staffing needs met and 2 prevention social workers. And that plan, based on the commissioner's statements yesterday, would be what would be presented for the public hearing. So, feel really good about that. Obviously, there was a lot more that we needed, but, I feel good about that. This is why you see these, little cups here. Our foster care staff felt like, this was so important that we needed a visual aid. And they came up with several ideas, and this is the one that stuck. And so what you see in front of you, 10 children per cup. A few of them have lost their heads, so they're probably running away somewhere. Their faces are falling off. But this is what our caseworkers are trying to carry. And it's a lot. And this includes our 18 to 21. So there's 230-some children represented here. So, okay. The farm bill, I will tell you a second about the farm bill, because I think I've covered everything else. A couple of you got an email from the Justice Center about having some interest in us having thoughts and making sure that our congressional delegation understood that the farm bill was going to be a problem. And the farm bill issue has to do with the fact that there's going to be work requirements. Pitt County's ahead of that game because we already have work requirements for our folks. The work requirements are going to be increased. People with children 6 and older will now have to participate in work without potentially the daycare supports to go with that. They're going to do away, the recommendation is to do away with categorical eligibility, which means fewer people will be eligible for food stamps in the county. Right now, it also means, right now when somebody receives TANF or SSI, they're not subject to the gross income test and they get some extra allowances. We don't have to worry about reserve. There's a whole lot of things. If that goes away, then we'll have to handle these individually, so it will be more work for the county staff. But the biggest issue is it's going to be bad on the folks with children and the folks who are elderly. Pitt County has 29,357 individuals currently receiving food stamps, and you know, some of the data that they provided indicates that a lot of these children, a lot of the folks that will be injured will be the children and the seniors. There's some significant concerns about this particular bill, and I don't know if you individually want to reach out to the congressional delegation one-on-one, or if you want to do something as a board, but we need to move pretty quickly because the bill is in Congress right now in the House. I don't know that the Senate is as strong a supporter of this bill as the House is, but it is significant. And remember, it also stimulates the economy. 9,700 grocers in North Carolina benefit from this program, so it's not just poor people who will be impacted, it's some of the grocers too. So y'all can decide what you want to do there. The fun thing is that Pitt County got an Excellence in Communications Award. They got 3 of them. And one of them was for the work that Mike Emery's staff did with our staff to produce our annual report. So we were the first place, printed publications, and their comments were, this report looks like a great opportunity to highlight the work of DSS staff, which I assume is often overlooked, outperformer compared to other entries in the category. So certainly the PIO office had a great deal to do with it, but our staff put together a lot of the information and stuff that was in there too. So it was kind of a joint thing. So we wanted to make you aware of that. You have the invitation to the foster parents picnic, and certainly you all are invited. And that is all I have, and we almost made it by 5:30. This was a big one. There was just too much going on. Do pay attention. There's an agency listening session. They are going to do it in Pitt County, so you have that information. Certainly, I hope some of you all can go to that.
You're done?
I'm done.
Any questions for Jan on any of the items that she had to
Run
Sit through.
No.
say? Any board member comments?
I'd just like to respond to something that we were talking about earlier with Becky around recruitment of potential workers. I would like to say that on April the 13th, the School of Social Work had a career fair, and there were, Pitt County DSS was there, but there were other DSS agencies, and the students were really hyped up. And one of the things they said was, I didn't realize DSS agencies did all of that. So I think it's a matter of education and putting the information out there. And we plan to have that career fair next year as well.
We also went to the career fair in Chapel Hill, so we hit both.
And one thing that's hard for a 21, 22-year-old to think about is the long-term versus the immediate
Yes.
return. And Pitt County still has very strong long-term benefits in state retirement, 401K, a pretty good health insurance plan, and those types of things, which when they are 55, they will appreciate differently than they do at 25. And so I think as we market the county at these various job fairs, we have to talk about strengths of benefits that come, which may not be out there in a private practice or a small, office setting where, yes, they can do social work, but they may still be having to do it at 70 when they could have retired at 30 years with the state side, so. But I do think that's something that's hard. I mean, money going into a 401K doesn't feel like anything when you're 22 and trying to pay for your car and school loans but there is that forgiveness if you go to work in a local government, not-for-profit setting, so need to make sure they're aware of that as well. Jim, Becky?
We have two very proactive board members in this case in point that we're talking about. Thank you, Sheila, for your efforts, and Melanie, thank you for your efforts. We've needed this for quite some time, and y'all got it going on. Thank you.
Thank you.
I talk to a lot of students, and I talk to a lot of
Yep.
BSW, MSW, and I point out that it feels good to retire at 50. So maybe some of that sinks in sometimes. Otherwise, our next meeting is Tuesday, June the 12th. And if nothing else, good for the cause, a motion to adjourn is in
I
order.
move that we adjourn.
Nelson?
All those in favor, pick up your stuff.
Pick up this.